Today we're going to talk about epidemiology, biostatistics, and the business of prevention, which is the business we are in public health. When we talk about prevention in general, we talk about three different kinds of prevention. Primary prevention, which is an effort to prevent disease or injury before it occurs. Secondary prevention, which is an intervention to reduce the impact of disease or injury after it's occurred. And tertiary prevention, which are interventions to soften the impact of ongoing disease or injury. So let's practice that a little bit. Here you can go to a quiz, put in the access code, and it's a little matching quiz to help you understand primary, secondary, and tertiary prevention. So first off, what is epidemiology? Well, all of you will be taking, or may already be taking, I can't remember, a course in epidemiology. It's the way that we find the causes of health outcomes and diseases in populations, not in individuals. It's a study of the distribution and determinants of health-related states and events. So it's really the way that we figure out what causes what and how many people are affected by it. So it was the Surgeon General's report in 1964 on cigarette smoking and lung cancer that told us that, cigarettes are bad. And that was an epidemiologic study. When we're working in public health, one of the things that we will do is an epidemiological assessment. Remember, that's one of the three functions of public health, is to assess the situation. So this will help us know which health problems are important, objectively measured. Now, sometimes, as you'll learn in other classes, subjective measurement is also important. We need to know how people feel. But objectively measured, we can figure out which health problems are important, and we can figure out which behavioral and environmental factors contribute to those health problems. One type of epidemiology that's really important is descriptive epidemiology, where we sort of look at the relative importance of different health problems in terms of morbidity, mortality, and disability. So if we are doing an assessment and we find that certain health problems have very high mortality rates, or if there's a lot of people who are sick with this condition, that might be the thing that we decide to work on, when there are probably many other things also that are important, but not quite as important. So we also look at how that importance varies among subgroups of the population. For instance, we know that certain subgroups of the population are more likely to have type 2 diabetes. So when we're doing an epidemiological assessment, the first step really is to define and quantify the health problems in detail in a community. And that's, first of all, to establish the relative importance of those various health problems in our population. Another reason that we do step one is to provide a basis for setting program priorities among the various health problems and subgroups. So if you're working at a health department and you want to decide what problem do I need to really work on, what am I going to take to my boss, you need to have some basis for setting those priorities. Some of the common indicators that we look at in epidemiology are, of course, mortality, which is really easy to count, and so epidemiologists like it. Morbidity, which is really how many people are sick. And then harder things to count are disability, discomfort, dissatisfaction, and life expectancy. And then sometimes we will look at relative fitness or years of potential life lost. So how do we make comparisons using epidemiology? Well, we generally use rates, which have to do with time, like rate of speed has to do with how fast you go, per hour. So the number of events in a population per some unit of time is how we really look at comparisons. So there are two important kinds of rates. The first kind is the incidence rate. And incidence measures the number of people who are newly infected or who are new with a disease. And then prevalence rates are how many people continue to have a disease over a period of time. One of the ways we make comparisons in an epidemiological assessment is population attributable risk, which tells us what mortality or morbidity can be attributed to a behavior or an exposure. And for that, we look at the incidence of the disease in the total population minus the incidence in the exposed population over the incidence in the total population. So to find out what attributable risk cigarettes have on mortality from lung cancer, we would take the mortality in the total population minus the mortality in the exposed population over the total population mortality, and we could see how much of this was related to cigarette smoking. There are also other ways we make comparisons, for instance, cost-benefit analysis, which tells us, is the cost of the program kind of worth the benefit that we get from the program. We also look at adjusted rates, so we can adjust rates by age, gender, ethnicity, etc. And this becomes important when we're looking, for instance, at mortality. So if you looked at mortality from heart disease in Florida compared to mortality in New York, if you didn't do an adjustment by age, it might look like people are dying off like crazy in Florida, but it could be because there are a lot more retired folks in Florida than there are in New York. So we need to use some kind of an adjustment. So when we're using an epidemiological assessment to set priorities, we want to know which problem has the greatest impact, and are certain subpopulations at special risk. So if there's a problem that has a great impact in terms of death, for instance, in, let's say, young people, that might be something that we would want to look at very carefully. We also might think about which problems are the most susceptible to intervention. So if we're trying to set priorities based on our assessment, even if one disease seems to be a lot more deadly than another, but it doesn't look like intervention would make any difference, then we probably wouldn't go with that problem. We also want to look at what problem is not already being addressed by someone else. And we want to look at which problem, if we address it appropriately, has the greatest potential for a positive yield. In other words, it's going to make a big difference in the number of deaths or the number of people who are ill. And one more thing we probably would look at is, are any of the health problems highly ranked as a regional or national priority? And if you're interested in what those regional or national priorities are, you can go to Healthy People 2020 online and you can see the list of priorities that have been set for the nation. So the second step in our epidemiological assessment is the etiology, or what causes disease. So we want to look at behavioral risk factors, environmental risk factors, biological risk factors. And generally, to understand the relative risk, we would look at relative risk or odds ratio. So relative risk, for example, is the incidence in the exposed population divided by the incidence in the unexposed population. And that helps us to see what the risk is for this particular factor that we're looking at. There are several different study designs that we can use in epidemiology, and you'll learn all about those in epidemiology, but your book chapter also goes through several of those, for instance, cohort studies, case-controlled studies. And there are lots of different reasons for error, and the book also reviews some of those, so make sure you read those chapters on epidemiology. Sometimes we are too quick to decide that one study is telling us the answer, but we need to really pay attention to possible other alternative explanations before we start, putting things on Facebook. So I think it's really important to understand the study designs and the ways that we can be led astray. So again, read the book, a chapter on that, and you'll talk about that a lot in the epidemiology class as well. What can we say about biostatistics? We wouldn't have any research without biostatistics, because that's the way that we analyze the data that we gather from human subjects for biological phenomena. And it's really very important for us to understand biostatistics, the different tests that are available, and the ways that we can interpret those tests. So I am not going to give you very much on biostatistics. There's a chapter in the book. You will all take a biostatistics class, and it's usually nobody's favorite, but it's really important. So I think that biostatistics is not the most popular subject in public health, but possibly one of the more important ones, because without statistics, we wouldn't be able to really know anything about the data that we've collected. So I'm trying to keep these slideshows kind of short, and I am trying a new way of recording. We'll see if it works. But I do need you to read the chapters fairly carefully. I have also posted some kind of fun activities that you can do to figure out how epidemiologists do assessments of outbreaks. So don't forget to do that. And I look forward to reading your papers, which I'm going to be doing today and tomorrow. So have a good day. Bye.